Parenting podcasts can be a bit earnest. Parenting Out Loud is not that podcast.
This person who I may not agree with politically is trying to talk about integrating children, not just into his professional life, but into public life.
I have referred to myself as one and done. That article did make me rethink the term.
It took about 11 seconds for this to go viral.
Oh God, is this the ejaculate one? That is deranged and I love it.
Parenting changes the way you see everything. Parenting Out Loud takes the big conversations of the moment and puts them through that filter.
Because if parents are thinking about it, we're talking about it.
Parenting Out Loud. Listen weekly wherever you get your podcasts.
You're listening to a Mamma Mia podcast.
Go commando.
Yeah.
Let the girl breathe.
Let
She
the
needs
girl
some air
breathe.
down there.
Nothing like a smelly vagina.
Nothing like a smelly vag, right?
I usually go bare or choose breathable soft cotton if I just want a bit of coverage. It's usually hubby's briefs, which is
Nothing
super
like
comfortable.
boy knickers, right?
So
My husband hates
comfortable.
it when I call them knickers.
Yeah, to be honest, it depends on the weather. Although annoyingly, hubby often finds when I am bare that it is an invitation for play.
It's not always an invitation. I mean,
Just
sometimes.
let it breathe, buddy.
Hello there, Australian women. Welcome to your full body health check. I'm Claire Murphy, and I have done not one, but two bowel cancer screening tests. Yes, it was not the most elegant experience, shall I put it that way? You do have to get up close and personal with your own poop, but gross for a moment for some long-term peace of mind.
Yes, and I'm Dr. Mariam, that annoying doctor who is going to continually remind you to do those tests.
We're talking about bowel cancer today. I've got quite a personal experience with it, not me personally, but I lost my grandma to bowel cancer. She was quite young. I never got to meet her, my dad's mum. I lost my friend Mel De Lacavalerie, a wonderful human being, to rectal cancer a couple of years ago. And also my friend's brother-in-law just passed away from it. So it feels like it's a little bit everywhere for me at the minute. And I know this is the case for a lot of people. And we were always told that bowel cancer was something that older Aussies had to deal with. But as we are finding out more and more, that is not the case. And that's something we're going to try and find out today with colorectal surgeon Dr. De Lacavalerie to try and get to the bottom of. So.
Yeah, look, sorry to hear, Claire. It is becoming all too common. Many of us now know someone affected by bowel cancer, and it is now the deadliest cancer in Australia for people aged 25 to 44, and it is on the rise among younger people with an 8% rise each year. In fact, Australia has the highest rates of early onset bowel cancer. And I've seen firsthand how this disease affects younger Aussies. I have many patients under the age of 50 who have been diagnosed with bowel cancer, and unfortunately, many of them have had their symptoms dismissed by other health professionals.
So being told they're too young?
They've been told they're too young or that their symptoms are just minor. But the reality is it is something we need to be taking seriously because it is on the rise, especially in that younger population.
Yeah, absolutely. And we are going to get into that today. But we also have a quick consult coming in from Casey about the deal with the doctors where she lives and whether she can live her health life maybe a little more remotely than what she is currently. But next, are you a wear an undies to bed kind of gal, Mariam?
I usually go bare or choose breathable soft cotton if I just want a bit of coverage. It's usually hubby's briefs, which is
Nothing
super
like
comfortable.
boy knickers, right?
So
My husband hates
comfortable.
it when I call them knickers.
I wonder why. Yeah, to be honest, it depends on the weather. Although annoyingly, hubby often finds when I am bare that it is an invitation for play.
It's not always an invitation. I mean,
Just
sometimes.
let it breathe, buddy.
Well, we are going to find out next whether undies to bed or no undies to bed is good for you because it's time to head off to med school.
Welcome to med school.
Should you wear undies to bed, yes or no, is the question we are talking about in med school today. There is agreement across gynecologists and other health professionals that going without underwear to bed is beneficial for vaginal health, especially for women who are prone to irritation or to infections, for example, BV and yeast infections and things like that. The main reason is that wearing underwear, especially if it's quite tight or if it's a non-breathable fabric, like you mentioned, you wear a more breathable cotton undie to bed, it can trap in the heat and moisture, and that can create the ideal environment for things like bacteria to multiply. And that then will increase some of those infections that we've talked about, and odour can increase as well.
Nothing like a smelly vagina.
Nothing like a smelly vag, right? However, it is important to note that whilst there is a fair amount of agreement across the spectrum that no undies to bed is more beneficial, there are no large-scale peer-reviewed clinical trials that directly answer that question. So this is mostly anecdotal and just experience amongst healthcare professionals. And so there's nothing to show that the rates of vaginal infections will increase or decrease depending on whether you wear underwear to bed or not. So I guess it's more just like sleep in your undies or don't sleep in your undies, whatever works best for you. But where do you stand on this?
Okay, so I am of the camp that if you've got like itching, recurring infections, or you're quite sensitive, then just let the area breathe overnight. It can be a good part of a good hygiene strategy. But if it's something that's persisting, please see your doctor, because there are a lot of things that can happen down there that can be treated, but you can definitely give it a go. Go commando.
Go commando.
Yeah.
Let the girl breathe. She needs some air down there. All right, it is checkup time, and we're going into an area that, let's be honest, none of us really want to go because we're all a bit grossed out by it. But if the stats are anything to go by, we really should be delving into our bowels. So that is where we're going next.
It's time for the checkup.
So here's the thing, and you have mentioned this, Mariam, bowel cancer is the deadliest cancer for Aussies aged 25 to 54. And 1 in 16 Aussies are expected to be diagnosed with it in their lifetime. That's quite a few of us. And there's also been some really recent headlines, which we will speak to Dr. De Lacavalerie about when we catch up with her a little bit later, that the rate of younger Aussies being diagnosed is actually on the rise. So almost 99% of bowel cancer cases can be successfully treated if picked up early, which is amazing, which is why we're finding rates in people over 50 declining, because we do have that population-wide bowel cancer screening program going on. I have just recently done mine, and I'm not over 50, but the Australian government has recently changed the guidelines around this. So when you turn 50, you get it automatically sent to you for free. But if you are now 45 to 49, you can still get it for free, but you have to go onto the website and request it. Yep. So it gets sent out to you still for free.
Please do that if you are in that age bracket.
Yeah, absolutely. But also too, if you are younger and have some concerns, you can buy it from the chemist. You can do it whenever you want, really.
And just to add to that, Claire, just remember screening is for people who don't have symptoms. If you do have symptoms, please see your doctor.
Yeah. So if there's blood, go to the doctor is basically it. I also filmed mine. So like...
You filmed your shit?
Yeah. If you just want a bit of insight because you're a little bit like, I don't know how this works.
Super easy.
It is easy.
Yeah,
okay. You have to get up close with your poop, but how else are they going to figure it out, right? Mariam, when do you start to look into bowel cancer with your patients? Like, what are they coming into you with?
So when it comes to bowel cancer, the biggest game changer, hands down, is early detection. As you mentioned, 99% can be successfully treated if we pick it up early. So I'm constantly reminding my patients it's not about waiting for a diagnosis. It's about spotting the red flags before things escalate. So screening is brilliant. It doesn't catch everything, and symptoms can show up at any age. So if you've had any of the following for 2 weeks or more, please don't brush it off. Book in with your GP. Early conversations can save lives. And here's what I kind of expect to look out for. Blood in your stool, whether it's bright red, dark, it's worth checking out.
Just FYI, if you eat like a crap load of beetroot, it will turn your poo red. Or your iron supplements might also make it a bit of a funky colour. So it might not necessarily be blood.
Either way, still check out with your GP if you're not entirely sure whether it's diet related or it's something that's persistent.
Yeah.
You've got changes in your bowel habits. So you've got sudden constipation or diarrhea, or things are switching between the two. A sense of incomplete emptying. So you've just gone to the loo, but you feel like you still need to go. Not everything has come out. That's definitely worth mentioning. You've got bloating, cramping, or persistent abdominal pain, not just the overnight, I had some curry and I overdid it.
Yeah.
There's unexplained weight loss, fatigue, anemia. Your body's waving a flag there. Any new lump or bump in your tummy or rectum, again, do not ignore it. Look, these symptoms don't always mean bowel cancer. We could be talking about hemorrhoids, IBS, inflammatory bowel disease, or even anal fissures. But the point is they still deserve a closer look. Too many younger Aussies dismiss these things as nothing until it's much later in the game. And the stats back this up. So even if you have to visit your doctor multiple times or see another doctor to feel like you're being heard, please be persistent. Take these symptoms seriously. You know your body and you know when something isn't right.
So if I am concerned that I might be experiencing symptoms like you've mentioned there, what do we take to our GP for ourselves to be heard and then further tested?
So if you're worried you might be facing something serious like bowel cancer, here's what I would love for any patient to bring to your appointment. It really helps make our time together matter. So first, I would say keep a symptom diary. So just write down what you're feeling, what symptoms you're experiencing, how long it's been going on, how often it's happening, and anything that seems to trigger or relieve it. Details matter, even if it feels awkward to say it out loud. Bring a snapshot of your family medical history. That's really important, whether it's any close relatives, whether they've had bowel cancer or polyps or colonoscopies in the past and what those findings were. And let me know your own medical history too. Things like inflammatory bowel disease and other cancers or medications. There are lots of things that can increase your risk of bowel cancer as well. Bring your questions. So even things that you think might be small or embarrassing, write them down. Trust me, will give you that reassurance and really help allowing you to feel that you've had everything answered. And if it helps, I always say bring a family member or a support person. Take notes. It will help you to remember the details
later on. That's the thing too. Sometimes you leave your appointment and you're like, what did they just say to me?
Yeah, that happened yesterday with my obstetrician appointment. I'm like, hubby, did you write all that down? Because
I need to take a little recording device.
Yeah, so a support person is always great. And I always say come in something comfortable. Please don't come in activewear because sometimes we will have to do a rectal examination, not all the time, depending on what symptoms you have. So just wear something comfortable if we do need to do a physical examination. You don't really even need to do all those things. If you're just concerned for any reason, just book that appointment in, have your concerns heard. But yeah, symptom diaries are just a great place to start.
Can I just say a rectal examination is not as traumatic as you think it is.
No, it isn't.
Like I had to have one when I had hemorrhoids and you just lay gently on your side, pull your knees up, doctor does what they need to do and then you get on with your day.
Super quick. It's less than a minute. And what we find can have a massive impact on your management as well. So,
Get checked.
Get checked.
Don't ignore. All right. On the way, we do have a quick consult for Casey, who's concerned that living regionally means that she might have to get a little bit creative with her healthcare professionals. But next, Dr. De Lacavalerie is a colorectal surgeon who's going to take us inside our bowels to find out if we know what we're doing that's increasing those rates of bowel cancer amongst younger Aussies. So let's be honest, getting all up inside your digestive system, it's never going to be a pretty conversation.
No.
And we all feel like it's a bit icky and we don't really talk about it, but it's becoming increasingly clear that it's more and more necessary for us Aussies to have this conversation with the rising rates of bowel cancer. And the screening test, it's a conversation we have to have because you have to figure out how to do it properly and what the results might be and the implications of that. So Dr. Penelope De Lacavalerie is a colorectal surgeon. She's also a spokesperson for Bowel Cancer Australia. Yeah. So we started off by chatting to her about that Melbourne University study that recently came out that found younger Aussies are showing increased rates of bowel cancer. Now, we understand at this point it is not peer-reviewed yet, but it has been published and it shows that the incidence of bowel cancer is 3 times higher in Aussies born in the 90s compared to those born in the 50s. Why do we think that is?
It's an excellent question, and I wish I would have a one punchy line to say, do this and you will not get bowel cancer. Unfortunately, we don't know the full answer. There is research coming out. What we do know is that knowing the symptoms of bowel cancer, knowing your family history of both bowel cancer and polyps, and then acting and doing your screening will reduce your risk of developing bowel cancer. So knowing the things that we know and controlling the things that we can control is the mainstay really of what we try at Bowel Cancer Australia to get people to know. Why is this happening? Lots to do with the diet, lots to do with research around the microbiome and the lineage and the covering of our colon being influenced, in particular when we are in utero or inside of our tummies of our mom, and the exposure of different bacteria can actually make a difference.
Let's talk about symptoms, because I think everyone presumes that with bowel cancer, you're going to get a pain in your tummy, and that's going to be the thing that kicks it off. But there's a pretty wide range of symptoms from what I can gather. So there is people who report becoming anemic. Stomach pain is actually one of them, but obviously the one that we hear about the most is blood in your stool. So when you go to the toilet and wipe, we can see in the bowl that there is blood there. And we don't like to admit that we do look at our poos, but if you look at it afterwards, if it's very thin or very small, it might show that there's an obstruction that it's having to get past. Constipation and bloating, are those the symptoms that we should be looking out for in this case?
What is really important is to know your normal and then identify when things change. If you don't usually look at your poo, you should start looking at it. If you don't know what is the consistency of normally for you when you eat veggies and when you don't, then you don't know when things change. So knowing your normal, and in particular in women, is very important because our poos change around our periods. And
I was going to say period poo is a thing and it changes, right?
Exactly. And the diarrhea that you do in period, that's normal. So knowing the trend and knowing your normal is really important. But if you're going to remember one thing from this chat is the word bowel. It gives you all of the symptoms. So B is for blood in your stools. Blood is never normal. That needs to be checked. The letter O is for an obvious change in your bowel habits. And this is where we need to know the trend, because if there is a change that stays in your routine for 2 or more weeks, that needs to be investigated. W for weight loss or appetite loss out of nowhere. You're not dieting, you're not increasing your exercise, you're not purposely trying to lose weight, is always a sign that you need to have it checked. E is for extreme tiredness. And this one is a tough one because as women, we can be very extremely tired, and men as well. But, we have kids, we have periods, we have pregnancy. And usually the tiredness can be associated with iron deficiency. Now, iron deficiency is not a disease. It's a symptom of something that needs to be checked. And ultimately, the letter L in the word bowel is for lump or bloating in your tummy. And this can be associated with abdominal pain. There is an excellent article that came a couple of years ago that showed that 4 main symptoms in people who develop early bowel cancer can be present, and they include abdominal pain, diarrhea, iron deficiency, and blood in your poo.
When we're talking about abdominal pain, I know someone who had bowel cancer who sadly passed away from it now, but he was experiencing lower back pain quite considerably. And I think we forget when we look at what our internal organs look like that we think the stomach pain is quite far away from our back, but internally it's all kind of squished in there together. So could that also be a symptom?
That is a very good statement there, because the rectum is in the pelvis. The rectum itself is just in front of this tailbone. So you can get pain when the tumor is within the rectum because it gives pressure and it makes things harder to go to the toilet. And this is when you get this sensation that you cannot empty completely your bowels. It's another symptom. Or you get this change in the consistency or the width of your stools being a normal size to being very narrow or very hard to pass. So yes, that can be also a symptom.
You mentioned that the instance of increasing bowel cancer rates amongst young people could be diet related. And we've been told for a long time that red meat is the main offender when it comes to bowel cancer. Is that still the case, or do we know more about our dietary habits that might be contributing?
We do know that having more than 350 to 500 grams per week of red meat is really too much. We are a country that eat too much red meat. Not everybody needs to be vegan or vegetarian. I'm not advocating for that, but everything in moderation is really important. Our diet is also very low in fiber. We should be really having a minimum of 30 grams of fiber in our diet. We struggle to even get to that. Ideally, we should have more than 50 a day. We don't do enough exercise, and in particular, teenage and young childhood obesity is linked to early onset of bowel cancer. Taking some dairy is important every day. Even if you're lactose intolerant, having some calcium-related supplements because the research shows that 400 grams a day is important to have in your diet. We eat a lot of processed meats and processed foods and deli meats and things that are nitrate full, and a lot of all the things that we add to processed foods that our grandparents in the 50s didn't used to have, which is also being attributed to this increase. And then there's a lot of talks about microplastics. So it's not one thing, but the things that we can control is our diet. And if we can make it varied and look like a rainbow every day, then it's fantastic because you're having all the well-balanced food.
Now, obviously, Australia is leading the world where it comes to bowel cancer screening, and we're very lucky to have a population-wide screening test, which comes in when you hit a certain age here in Australia. But can you talk us through how accurate that test is? Because I think some people think if they do that, send it away, then they can ignore any other symptoms they might have because that comes back as negative. But how accurate is it, and how do we make sure we're doing it right?
You just said that very key symptoms. If you have symptoms, you don't need the screening test. You need a colonoscopy. So we need to remember that there is two main reasons why you need a colonoscopy. One, because you got symptoms or you have family history, and then therefore you should have it because of your family history. Or you have no symptoms, no family history, and you are at the age of 45 or more. You are between 45 and 74, which is the screening test in Australia. The screening test is not 100%. Nothing in life is 100%. In particular, in medicine, nothing is 100%, unfortunately. It's only just under 70% accurate. So it basically means that, yes, you could do the test and it could be a false negative. It's not very common. But if you do have symptoms, then you don't need the test. If you do not have any symptoms, then it's very good. And then you do it every 2 years. And then if it is negative, you don't need a colonoscopy.
Can you just talk me through diagnosis and treatment quickly? I understand that it's not a simple thing because bowel cancer can present differently in different patients. But if we were to look at going in and getting a diagnosis and we are confirmed as having bowel cancer, what does that then look like for someone?
First of all, you have a colonoscopy, so you have the bowel preparation, and then the day of your colonoscopy, the most likely scenario, or usually what I would do as a colorectal surgeon, is that I would talk to you after your procedure. So I will discuss with you the findings and that we have taken some biopsies, and then the biopsies will confirm it. But until then, there will be some tests done, including some blood tests, a CT scan, and sometimes an MRI if what we found on the colonoscopy is within the rectum. The main reason why we do those tests is to what we call stage the disease. And that will guide us if you require surgery first, so straightforward, or if you require chemotherapy or radiotherapy or both before having surgery. Sometimes you don't have surgery for a long time. Sometimes we don't have surgery at all because we follow a protocol called watch and wait, which is mainly for people with rectal cancer that respond well to chemotherapy and radiotherapy. So what we're finding is that treatment is becoming better and better from the chemotherapy and radiotherapy point of view, and we're having to operate less and less in rectal cancer. Now, in colon cancer, surgery is the most common scenario unless there is spread in the staging test that I just talked about into other organs like your liver or the lungs or other parts. And then the main priority there is to treat those organs first, as long as there is no impending blockages in the bowel or there's not a lot of bleeding. Then what is going to limit people's longevity or survival is curing or treating the distant disease into the other organs. So there's a bunch of people involved. There's oncologists involved, radiation oncologists involved, nurses, pathologists, radiologists. So everything happens very, very quickly, and it can be a little bit hard to catch up the first few weeks when everything is happening. But I just want people to know that there will be always a team behind your back guiding you every step of the way.
I want to ask you too about those who are particularly more at risk of developing bowel cancer. And I've got some friends who have a genetic link through family that they regularly get colonoscopies and they have polyps removed, which are sort of the pre-cancerous stages of bowel cancer. Are there anyone in, say, cultural backgrounds, or is it more women, more men? Like, are there groups that are more particularly prone to bowel cancer?
to help patients, not only in this scenario with family history. It's also good to know that Bowel Cancer Australia has bowel cancer nurses that you can discuss to about. And we have dietitians and we have stomach nurses that take care of people that need bags during the operation. So that's also, something to think about. Hereditary bowel cancers are very rare. They're not the most common scenario. It happens in about 10% of bowel cancers, and it's usually linked to syndromes that produce a lot of polyps, and therefore those polyps put you at risk of having bowel cancer. Is there a particular population? Not particularly. There is some particular populations within the Jewish community that can be more predisposed to some of these syndromes, but there is not like a particular race. Cancer doesn't discriminate, basically, when it comes to bowel cancer. What is really important, I think, for your listeners is that if you have a first or a second degree relative in your family that has polyps, is as important as family history of bowel cancer, because it puts you at risk of developing polyps. So if your sister had 20 polyps or 10 polyps, or your mom had 20 polyps and you never had a colonoscopy and you're in your late 20s or early 30s, it's worth it discussing it with your GP and having a colonoscopy.
So, Mariam, we've spoken pretty often in our time here on Well about how a Western diet is impacting us in lots of different ways, and it seems that bowel cancer is also part of that conversation.
Yep, absolutely. It is not doing us any favours when it comes to bowel cancer, and that's a conversation we cannot afford to ignore. So a major factor in the rise in bowel cancer is our diet, and it is that we are consuming high amounts of red and processed meats, so things like beef, lamb, pork, sausages.
And look, as a kid who was brought up on those really highly processed deli meats, you've got to be careful not to eat so much of that, right?
And it's not just about what we're eating, it's also about what we're not eating. So diets low in fibre, so found in fruits, vegetables, legumes and whole grains, are associated with a higher risk of bowel cancer. I encourage everyone to really be mindful of their diet, aim to limit your red meat consumption.
Which sucks for those of us who are iron deficient, because we're told to eat more red meat.
It's hard, right?
It's tough,
We should not be having more than 350 to 500 grams per week, and we should be avoiding processed meats as much as possible. Instead, focusing on a diet rich in fibre, so lots of vegetables, lots of fruits, lots of whole grains, and making those dietary changes can really reduce that risk of bowel cancer.
Okay. It's going to be a lesson that we're going to be saying over and over again. Check your diet, but it's becoming increasingly clear that we have to be better with that.
Sometimes I tell my patients if they can aim for like 1 or 2 meat-free days a week, that can make a difference as well.
Or even just like every day thinking about a fruit or a vegetable you can chuck in. Like start off easy on yourself and then increase that, right?
Yeah, just be mindful.
All right, next, it's time for today's quick consult. Remember, if you do want a question into Dr. Mariam here, there is various ways you can do them. You can send them in via email, well@mamamia.com.au. You can get into the waiting room, which is an online form where you can remain anonymous if you wish. There is a link to that in our show notes. And hit us up in the DMs. I do love a chat with people in the DMs. Yes, you are legitimately speaking to me. It's not someone pretending to be me. I am a big fan of chatting to you in the DMs, so get on it. Today, Casey wants to know whether she can conduct all her health needs without ever seeing her doctor face to face. It is quick consult time. Casey wants to know how remote she can go. So, Dr. Mariam, if you would please do the honours.
The doctor will see you now just through here to consult room 1.
Thanks for waiting. How can I help you?
Casey reached out on the DMs to ask us about a problem that I've previously spoken to you about, Mariam, because I do live in regional New South Wales.
Yep.
And sometimes when you've given advice where it's about finding the right GP for the condition that you're dealing with, and you can go online and look at doctors' profiles and that will tell you what their specialties are, sometimes you don't have that option because you live in a regional or remote area where there is a very small selection of GPs. So this is what Casey wrote in.
So I live in a small regional town and some of the doctors are a bit older and out of touch, and it's majority male-led practice. They don't have the best bedside manner, and for intimate issues, I just really prefer to see a female doctor. Can an online video telehealth doctor be my regular GP, or is it better to just have an in-person doctor and call it a day?
Casey, I get you. I've had to resort to telehealth doctors for certain issues, but can you do it full-time?
So you can absolutely have a telehealth GP as your regular doctor here in Oz, especially if you're in rural or regional Australia, where accessing specialists or GPs with special interests can be a little bit tough. Telehealth is starting to become a bit more mainstream. It's breaking down barriers and bringing great care to patients that could otherwise not receive that care.
We do have some things to thank the COVID pandemic for, right? Because it did open up a lot of these avenues for us.
That's true. To qualify for a Medicare rebate for telehealth, you need to have an established clinical relationship with the practice, which usually means having had an in-person consultation with a GP or another healthcare professional at the practice within the last 12 months. But the good news is starting November this year, if you're registered under My Medicare, it's easier to do through MyGov or the Medicare app or through the GP clinic. The 12-month face-to-face requirement will be waived, so making it even easier to access telehealth care. What you can do via telehealth, well, you can manage lots of things. You can get your repeat prescriptions, mental health support, navigate chronic disease management, receive general health advice. It's fantastic. That said, telehealth isn't a full replacement for face-to-face care, but it's an outstanding supplement when paired with in-person access. So just remember those face-to-face visits are still important for blood pressure checks, for physical examinations, for health checks. So when you can, get those face-to-face checks in, but everything else can be done via telehealth these days.
Yeah, we were talking about rectal exams before. I don't think that's something
it's not going to happen.
We can do over the phone. But that's really good to know, though, because for people who do live out in the regions, sometimes you've got 100 200 kilometres to travel to find your next doctor. It's not easy to navigate. And seeing specialists sometimes requires multiple trips, and that can be hundreds and hundreds of kilometres racked up in travel.
And it's expensive.
It is expensive. So, yeah, I understand your issues, Casey. Hopefully that has helped you out. Thank you for lending us your ears today, friends. Remember, Dr. Mariam is not your doctor, as much as that makes us very sad. So the advice you've heard here today is general. So you need to take it to your doctor and say, this is what I've learned, this is what I would like you to help me with, and see if that information can help get you to where you need to go. But you need to get info that is specific for you. So make sure you do that with your healthcare professional team to keep that body functioning. While we have you captive for a second, could you just maybe do us a solid and rate and review us on your podcast app?
Yeah, please do.
It does actually help us out, so you would be doing us a favour. A 5-star would be ideal, but like whatever you want to do.
Nothing less.
We've had feedback that sometimes the content that we do might not be relevant for you listening in that time. And that really helps us out to make sure that we broaden out that there will be something that will be relevant to you regardless of what the main topic is. Yeah. So that feedback comes in from you guys and we really listen to it and respond to it. But there will be fun stuff every episode. So where else are you going to find out the health benefits of free bowling in bed, you know?
That's right.
Right here on B.O.W.E.L. Thank you. We will catch you for your appointment next week where we are talking about breast cancer.
Bye-bye.
B.O.W.E.L is produced by me, Claire Murphy, and our senior producer, Sally Best, with audio production by Scott Stronach, video production by Julian Rosario, and social production by Ellie Moore.
Mamma Mia acknowledges the traditional owners of the land we have recorded this podcast on, the Gadigal people of the Eora Nation. We pay our respects to their elders, past and present, and extend that respect to all Aboriginal and Torres Strait Islander cultures.